Welcome to Dentistry Q&A, the hub for dentists and dental students. Here, we simplify complex dental concepts, share clinical tips, and answer the questions they don't teach in textbooks. In this video you will going to learn the 21 principles of smile design. They should look taller than they are wide, kind of like a standing up rectangle, not a square. Dentists use a guide called the width to height ratio to check this. It means your tooth's width, side to side, should be about 75 to 80% of its height, top to bottom. Example, if your tooth is 8 mm wide and 10 mm tall, then 8 divided by 10 is equal to 0.8, that's 80%, a perfect ratio. This shape makes your teeth look more natural, healthy, and attractive. If the teeth are too short or too wide, they might look square or unnatural. 2. Mesial inclination. When you smile, your front upper teeth should slightly tilt toward the center of your face. Imagine drawing a straight line down from each tooth. These lines shouldn't go straight down, they should tilt inward a little, like they're all pointing to your belly button. This gives your smile a balanced and natural look. 3. Midline placement and cant. Your smile should be centered on your face. The line between your two front teeth, called the midline, should line up perfectly with the middle of your face, starting from the space between your eyes, going down through your nose, lips, and chin. This line should be straight, not tilted to one side, so your smile looks balanced. 4. Color shading, stains and markings. When we look at teeth, we should check 1. Color. Are all the teeth the same color or shade? They should ideally look uniform and bright. 2. Shading. Sometimes, one tooth might look darker than others. This can happen if that tooth is damaged, has a filling, or is dead. 3. Stains. Are there yellow, brown, or other colored stains on the teeth? These can come from coffee, tea, smoking, or poor cleaning. 4. Markings. Do you see white spots or dark spots on the surface of the teeth? White spots might mean early tooth decay or too much fluoride, while dark spots could be cavities. 5. Smile at rest. When your face is relaxed, not smiling fully, a little bit of your upper front teeth should naturally show, usually 2 to 4 mm. Younger people usually show more of their upper teeth when their mouth is at rest. As we get older, the lips might droop slightly, and less of the upper teeth and more of the lower teeth start to show. Small orange diamond. Why it matters? How much of your teeth show at rest affects how youthful and balanced your smile looks. 6. Gum line symmetry. Your gums act like a frame around your teeth, just like a picture frame around a photo. The gum line, where the gums meet the teeth, should have a smooth, even shape on both sides of your mouth. The curves of the gums around each tooth are called scalloping. They should look the same on the left and right. If one side is higher, lower, or uneven compared to the other, the smile might look unbalanced. Small orange diamond. Why it matters? A balanced, even gum line makes your smile look neat, healthy, and attractive. 7. Gum line margin height. The gum line should not be the lateral incisors, the two teeth next to your front middle teeth, should have their gums slightly lower than the gums of the central incisors, middle front teeth, and canines, the pointed teeth next to them. This small difference in gum height creates a nice, natural curve that makes the smile look balanced and attractive. Backhand index pointing right. Remember, middle teeth equals higher gums, side teeth equals slightly lower gums. It makes the smile look soft and natural. 8. Gaps and diastema. A diastema is a gap between the teeth. Is there a space between your front teeth? 9. Gummy smile. A gummy smile is when too much gum tissue shows above your front teeth when you smile. How much gum tissue shows with a full happy smile? Ideally there should be only a slight amount, 1 to 3 mm, of gum tissue showing above the front teeth when you smile. 10. Gingival zenith. What is the location of the uppermost height of the gum line over each tooth? The height of the gum line across the face of each tooth varies from tooth to tooth. It should be centered over each lateral incisor, and it should be 2/3 rds of the way across the face of the tooth for the central incisors and canine teeth. 11. Smile line follows lip. Does your smile line generally follow your lower lip line? The incisal or biting edge of the upper teeth should parallel or follow the contour of the lower lip line in a relaxed or slight smile. 12. Horizontal plane. Are your teeth on a parallel horizontal plane with your eyes or with the floor? The left to right horizontal biting plane of the mouth should parallel the floor or the horizon when standing. It should also parallel a line drawn between the eyes, the interpupillary line. The horizontal plane from the front to the back of the mouth should also generally parallel the floor. Note: some people's eyes are not level in nature. 13. Gum tissue health/bad breath. Do your gums bleed when you brush or floss, or are they inflamed or red around the borders? Healthy gums do not bleed and are light pink in color and are stippled in texture, like an orange peel. Gum disease is linked to heart disease and can be very unsightly and smelly. Oral bacteria cause tooth decay, gum disease, and bad breath. Any plan for an attractive smile and good oral health must include regular dental cleanings and good oral hygiene practices. 14. Flossing contact points. Does the point of tooth contact between front teeth gradually migrate upwards from tooth to tooth? The flossing contact point between these teeth should step upward with each tooth. 15. Malalignment and crowding. Teeth should be even and straight. Are your teeth crooked or crowded in their positioning? Is there room for your teeth in a natural arch form with each tooth standing evenly side by side? Crowding happens when there isn't enough room for them or when the jaws are too small. 16. Incisal embouchure. Is there good definition and teeth on the incisal edge of the teeth? The size of the silhouette or outline shape between the front teeth should symmetrically increase in size moving away from the midline. This is best seen as a triangle-shaped wedge between the teeth and on the biting edge of the front teeth. 17. Golden proportion ratio. Are your teeth sized in the proper proportion? The golden proportion follows the rule of thirds. Each tooth away from the midline should be 2/3 as wide as the previous tooth. For example, measure the width of a central incisor in your mouth or on a photograph. Divide this width by the width of the lateral incisor next to it. The central incisor should be 1.6 times as wide as the lateral, and the canine 0.6 times as wide as the lateral, and so forth. Example: ideally, if the central incisor is 10 mm wide, the lateral incisor should be 2/3 of this amount, or about 6.5 mm, and the canine should be 2/3 of that, or about 4.4 mm. 18. Black triangle. Is there a dark space at the gum line between the front teeth? A black triangle appears between the front teeth when the teeth are too far apart or the underlying bone level dissolves away. When this happens, the gum papilla shrinks and allows the darkness from the back of the mouth to show through as a dark triangle. 19. Vertical dimension. Does the lower 1/3 of your face appear too short? The loss of vertical dimension makes your face appear older. The vertical distance between the nose and the chin can be short due to improper growth and development of the jaws and dental bite, or because the teeth have been ground down or are missing. As a rule of thumb, the measurement between the gum line of the top and bottom central incisor when biting on your back teeth ideally averages between 17 to 21 mm. For most people, this creates a vertical proportion to the lower 1/3 of the face that is pleasing to the eye and generally very healthy for the jaws and jaw joints. 20. Dark silver mercury filling. Do you have dark-colored metal fillings which show when you smile or laugh? Silver mercury fillings expand and contract, and create cracks in the teeth which weaken and damage the tooth. They also cast a dark shadow through the tooth and blemish the smile. 21. Old dentistry. Do you have old dental restorations which are failing or are no longer aesthetic? Fillings and crowns experience wear and tear just as do the teeth they are on. Also, because your natural teeth darken with age, it makes older porcelain crowns look lighter so that they don't blend in. Often old porcelain crowns have a dark metal line at the gum line.